Anyway, I'm George Grunberger, and it's my pleasure to moderate this wonderful panel of brave people who are here on the stage with me. And the idea is to talk about our march towards the artificial pancreas. And I'm going to open it up with a couple of slides, because not everybody maybe in the audience knows what I'm talking about. And then we'll open up to panelists who can tell us their life stories and journeys, and then open up to your questions, because clearly we are here to answer questions about hopefully marching towards that artificial pancreas. So everybody's ready? Thank you. Now, some people think that insulin pumps something new. As you can see here, this is nothing new. I mean, people have been dealing with pumps for a long time. This is the first model, not exactly portable, but Dr. Kadish, back in the 1960s, was using a little gizmo on himself. So this is presumably the first insulin pump. I'm old enough to remember using this in my patients. So I've been using, in my practice, insulin pumps since September of 1980. And this was the first commercially available insulin pump. I don't know if anybody's here old enough to remember. Sit down, Bill. Thank you. Auto syringe AS2C was the first pump we used, and we used to call it the big blue brick. It weighed a couple of pounds, and actually the insulin syringe was in the outside of the pump. So if you bumped it against something, it would be dislodged, okay? But anyway, this is the insulin pump in 1970s and 80s. And I always try to remind people that the artificial pancreas is really not one thing. And it's very confusing. First of all, it's not artificial. And certainly it's not a pancreas. So thank God that FDA finally got away from this, because FDA actually initially remember they talked about the artificial pancreas project. And so people really got confused, okay? And then you see what it is. Well, as I said, it's not artificial pancreas. So now the lingo now is AID, automated insulin delivery. Again, nothing new here. This is the artificial pancreas in 1970s. It worked perfectly. The problem was it was sort of difficult to play ball or do other things, because the poor patient was literally bound to the bed with two IV lines going in, one infusing insulin, one infusing glucose, but it worked perfectly. So again, nothing new under the sun. Hopefully life is getting a little bit easier. So I always try to remind people that, again, there's nothing artificial and certainly not a pancreas. What it is just a glucose sensor, a pump, and then you need something in between, some brains, right, to put it together. So the pump knows what to do based on what the glucose sensor does. And so this is something which actually I think Aaron Kowalski from JDRF he tried to do when FDA finally said, OK, this is going to be the pathway to the artificial pancreas. There are basically 6 steps. Not to bore you with this, OK? But if you sort of look clockwise from 1 to 6, and everything from the initial threshold suspend, so the pump would suspend insulin for up to 2 hours when you're below a certain level. You have to have hypoglycemia first for this to be activated. Then we are now at number 4, OK? So the rest of the day, we'll talk about number 4, i.e., so the automated insulin delivery. And right now, we are at only the first stage of that, right? Because this is a hybrid closed loop. It's not fully closed loop yet. That's coming later. But right now, it's hybrid, which means it's half and half, right? It only does things when you don't eat. The moment you start eating, the pump is not smart enough, the system is smart enough to figure out what you eat. You still have to do it yourself, and we'll hear about that. So this is the hybrid part of the closed loop. And so if you now sort of look at pathway from one of the companies has taken over the years. So this is from Minimed Medtronic, the diabetes part. And we sort of started here initially with the bolus wizard, and you might remember all these things. So this was like Minimed 523 model. And then we went on to the low glucose suspend, as I mentioned already, with the 530G and then 630G. And then, you know, that's wonderful. The problem is you have to get low to begin with for this to suspend. So then the question was, what's the next step? Next step was so-called predictive okay, low glucose system. This was a 640G, in which actually the suspension would be before you hit the low. The system could predict you're about to get low and will suspend insulin. The 640G has been around in Australia and Europe. It never got introduced here because, surprise, surprise, FDA approved the 670G so quickly that the company didn't have a chance to market 640G in the US. 670G is the hybrid closed loop. And the 690G, we don't have in the market yet, but hopefully be getting closer and closer to the fully closed loop, okay? So right now it's 670G. Now, in case you think that they're the only game in town, you don't have to read the slides, okay? This is just a list of companies which are trying to catch up. This is an incredibly active world, and I'm not going to, again, deal with details of this, but this is just companies from Tandem and Bigfoot and Insulet and on and on and on, both in the US and abroad, and this is a race. Who's going to be the first successful person or company to fully close the loop? Because obviously that's the Holy Grail. Now, so we'll talk about 670G. Well, I'll shut up and they'll talk. Remember, again, there's nothing artificial. It's not a pancreas, okay? So you deal with a sensor, which hopefully continuously measures glucose levels. Remember, it's not in the blood. And I'm getting tired of people telling me, I know what my blood sugar is. No, you don't. Because remember, the sensor is not sitting in the bloodstream, right? It just looks at glucose concentration in the fluid under the skin. And you hope it corresponds to the blood sugar. That's a different story. You have the pump. And of course, you have dedicated glucometer, which goes with that. So before I open it up, again, if you now talk about how the 670 actually works, it can suspend on low. So when you get low, it suspends. It can suspend before low. So this is the predictive part. When the system predicts you're about to get low, it can suspend. And the most exciting part, of course, is the auto mode, in which it automatically delivers, or not delivers insulin according to glucose levels, to run you at certain level. That's the auto mode. Obviously, it works only with the sensor, because if the pump doesn't get to hear from the sensor, it's not going to work. Okay? So again, it can work on these sort of three modalities. Now, I'm going to, as I said, open up to the panel, and I'll let them speak about their experience. First of all, how do they get to this system? And then whatever pearls of wisdom you guys might have, or girls. And then we'll open up to the audience. Okay, so you want to start? Am I right, please?
Is this on?
It's on.
Okay. My name's Lauren Dietz. I'm 24. I have been on this pump for almost a year now. I was diagnosed with type 1 at 12 in 6th grade. Begged for an Animus pump at 12 months, was so done with injections, and I was on that for a while. Then I kind of got brought into the Medtronic world when I realized that they seemed to be on the fastest track to getting to this closed loop, auto mode, not artificial pancreas. And so I was on a 530 and then got on the 630 and the 670. It's been life-changing for me. I don't know if I should go fully in detail. I know you guys will have a lot of questions.
Well, define life-changing in what?
I used to just be a person who would be waking up constantly through the night, waking up everyone in the house, as I'm sure most of you know, as my sensor is blaring and I'm just completely desensitized to it. And that has completely changed. And there are some nights, it's not perfect. It's not an exact science yet. But it has completely eliminated those nights where I'm waking up 3-4 times, chugging juice as if I'm gonna die. And just seeing that flat line and waking up to this beautiful blue shield on the front of my pump screen has just taken so much anxiety away from this disease.
But a blue shield means she's in auto mode.
Yeah.
Yes, you can get that one. Yeah. You?
I'm Grace Walkerdine. I'm a student. I'm at high school. I'm 17, and I was diagnosed at age 7 when I was in 2nd grade. And throughout having diabetes, I've had a pump. I think I got the Animus probably not even a year after I got diagnosed. And then soon after, a couple years later, I changed to Medtronic pumps and went through a lot of their pumps. And especially since high school, it's been a really rough ride with diabetes for me. A lot of missing a lot of school for it and not doing as well in school as I could have because of it, and just a lot of complications. And when we changed this pump, it just has helped in a lot of ways. Like, I don't miss as much school. It's a lot of work at first, especially. This pump takes a lot of effort from you and wanting it to work. But when you get it to work, it's so rewarding, and it really changes everything and changes your health completely.
Well, my name is Kerry Jones, and I'm a bit older than those two over there, but I've had diabetes. Well, first of all, I'm a nurse anesthetist, so this pump has just helped me out tremendously in my job. But I was diagnosed when I was in my senior year of anesthesia school, and that was tough. So was on pills, then eventually went to injections, along with drugs like Actos, which after those black box warning came out for that drug class, I told my doctor, I said, I am not staying on this. I'm already on insulin. We're going to insulin around the clock. I am not going to stay on this. And shortly thereafter, then ended up with an endocrinologist, and we went to the pump. So I've had a pump since 2007, I think, and the pump was great. I got lazy. So, it was working okay. In my job, it's just super stressful, and, your hours are crazy. You never know when you're getting lunch. So, I made it work as good as I could, but it wasn't great. So I was due for an upgrade, and it was, I think, December of 2016. So Medtronic, they're telling me about, we have the 630G. I'm like, okay, cool. If I can get an upgrade before the end of the year, great. He's like, well, it's waterproof or almost waterproof, and it has a color screen. I'm like, cool, color screen, I'm sold. I want it. And he's like, well, then you can have, be in the priority access program, telling me all about the 670G. And I'm like, I don't think so. I am not letting a pump regulate it. I'm just not doing it. And he's like, well, just get the 630, and then you can make that decision later. So I'm like, yeah, right, sure. I didn't want any part of it. I micromanage my patients. I am not going to let a pump do it for me, even though I wasn't doing a great job. So my doc is like, no, you need to be on that. So I said yes. And I started in auto mode in September. Did well, not super. And then I really engaged with it and changed my eating habits and was super serious on bolusing when you should bolus, which is key. And it's turned my life around. I can do things that I couldn't do before. A few weeks ago, I had my dog out. We were in the state park hiking. We did, I think, 4 miles in the morning, which I could never do 4 miles and get that far away from my car, even though I'd always glucose tabs with me all the time. But I'd be crashing. Even if I would suspend an hour before, if I knew I was going to do this, I would just crash. But with this, I don't crash. It figures it out, and it stops delivery ahead of time. 4 miles into the woods, I did great, no problem. Straight line across, virtually straight, maybe a little dip, but it's just unheard of. Later that day, we were out geocaching, another 3-mile hike, and no problem. I can go, if I am late getting lunch at work or wherever, I don't freak out. I mean, I'm feeling how I feel or sensing, but I don't worry like I worried. If I didn't have glucose tabs with me, and it got to the point I was feeding the pump. You know that? Mm-hmm. And I was like this, and I felt horrible, and I feel so much better. So it's changed. how I live. Gives me hope. I'd kind of given up before, so.
Before we go to you, I'd just like to remind you that the Teen Central is still going on upstairs in case you get bored here. For teens. The rest of you stay here.
Okay, so I was diagnosed 34 years ago.
Name?
Sorry?
What's her name?
My name is Bob Elkus. Anyway, so I was diagnosed 34 years ago. I was placed on the pump 4 months from diagnosis. And over the years, I've been on all kinds of pumps. I remember when the state of the art for a finger stick was to go we put the blood on a stick, and then you wash off the stick. You wash it with a spray bottle of water after a duration of time. And now we don't even think about it. But anyway, I've seen a lot of innovation over the years. And the pumps would get smaller. They would have flashier screens. But this pump is an enormous improvement over all prior technology. So a couple points I wanted to make. You still have to accurately dose your meals. You should become an expert on carb counting to get the most out of this pump or any other pump. But in between meals, and especially when you're fasting overnight, the pump just gently gets your glucose back into the normal range. So virtually every morning when I wake up, I'm between 110 and 120. The other point I want to make is that exercise, like you mentioned, exercise is so much easier with the pump. I like to do bike rides, and depending on the duration and the intensity of the bike ride, I used to have to eat a small to quite a sizable amount of carbohydrate, and then after the ride was over, my glucose would skyrocket once you stop the exertion. Now with the pump, there's no pre-meal feast. You just go on your ride, and the pump takes care of it. And after the ride, because you avoid loading up on all the glucose ahead of time, after the ride, there's no hyperglycemia. So I've been delighted with the pump, and I've been on the 670G since July of last year.
Very good. So this was sort of initial round here. One of the things, again, and you hinted at that, and also you hinted at that, is that the pump, the system, that's the pump, the system works that way in auto mode only when you don't eat, right? Because, again, the pump is not smart enough yet to figure out how to cover the meals. But the way I'm talking to my patients as far as advantage is because it is a lot of work. We'll talk about it in a second. It's not just by itself. You actually have to do still some work. And you mentioned that the quality of sleep, the fact that you should not be woken up either by your parents or yourself by these either bad spikes or even worse, having low sugar reactions. So can you elaborate on what happened as far as sleep? In other words, when the pump is supposed to be doing things on its own?
Like elaborate how?
Well, I mean, you mentioned already that you can sleep better, easier, more peacefully.
Yeah.
You don't have to wake up. Nobody has to wake you up to check the finger sticks.
Yeah, so when I wake up and I look at my screen, you can see throughout the night where my pump and its little brain were thinking I needed to back off on little micro boluses, essentially what they are. And they're these little pink dots at the top of the screen. And you can see at points of the night where if I had exercised or something throughout the day had caused me to drop at a certain point, it completely backs off on all mini boluses. And I won't get insulin for even an hour, sometimes even more than that if I had been dropping significantly. And then it basically stops me before I hit that 80 line, and I go low. And it doesn't even alarm. It doesn't tell me you are dropping, you're about to be low, which is also just another alarm that desensitizes us and wakes us up, which is convenient during the day. And if you don't have auto mode, it's really nice to know that you're going to be low soon. But that's just another thing that would wake me up on old pumps. So as soon as it stops me from going low, it just goes back into its little, usually flat line. And even if I were to spike the opposite, it just ramps up more little insulin boluses and keeps me within my little like 80 to like 160 range. the whole night, almost every single night.
What about you, Grace? Have you noticed a difference? Has the family noticed a difference?
Definitely.
In what way?
I used to wake up with lows that would last almost hours because of how much insulin I was on throughout the day. And now it's like I never wake up for lows. I have noticed more like it will go a little bit high, but then it will come back down. But the lows are like the scary nighttime, that would worry my mom and worry me, and I wouldn't really wake up to it a lot of the time because I'm so used to it. And now I just notice that I've gotten so much better sleep, and like the quality of sleep is so much better that I can just stay asleep the whole night and not have to worry about dropping.
You?
I totally agree. I think I still have a bottle of glucose tabs on my nightstand.
Just because?
Just because, but there's probably a lot of dust on it. But because I would wake up in the middle of the night with lows, and so I'd eat a bunch of glucose tabs, and of course you're like, oh, it's not working fast enough, and then you go get something else, and then you're on the roller coaster, and that has not happened to me in months. In fact, this is exceptional at covering or preventing lows. It's good at highs, but it's even better at lows, which is really the worst of the two. So, like I can sleep without worrying that my blood sugar is going to bottom out. And so.
Bob? Yeah.
The 670G is an amazing device. Not only has it improved my sleep, but my wife sleeps better too.
Right. I think that was the point, because whether you are a spouse or significant other, or if you're a parent of a child, your sleep was never the same. I mean, what I've heard is from parents who tell me this is their first time they were able to sleep since the kid was diagnosed.
Right.
Yeah.
Yeah, that's true.
Let me ask you something else, because as I mentioned, the thing really doesn't know what to do with meals. So how has your routine changed in covering or bolusing for meals since you've been on 670G? Has it?
Yeah, I've definitely, you get lazy when you have pumps and you use your bolus wizard. And in the past, I was definitely lazy, and in probably the first few months on this pump, for sure, I was still in that mindset. Just kind of letting, if I went over 200, like, I know it'll come back down, like, no big deal. I know it'll sort itself out. But it really can't that quickly. And you still can get up there in your numbers if you cover badly, or you count your carbs badly, or, I mean, things are still going to go wrong. But I really have had to fine-tune and kind of get back to how I was when I was first diagnosed 12 years ago, and I'd have my little carb counting books at the restaurant, and like now you can just go on Google, which is a lot more convenient. But I have had to get a lot stricter, and I still have a lot of work to do. I think my endocrinologist is in this audience, and he probably knows that. But it's helped a lot, and it's kind of forced me to be better.
And you?
Yeah, that's what I agree with that it kind of has got me on a better track with diabetes, because having it for 10 years, I've gotten very lazy with it, and now it kind of demands more of me in the bolusing ways, that I have to be more accurate with my carb counting, and I have to be more like in tune with what it wants me to do, because it'll ask when it wants stuff. And sorry, I got distracted. And I've just gotten a lot more responsible with it, and like in tune with what it wants. And also, before I would have to pre-bolus a lot, which was like 30 minutes of me waiting to eat and watching everyone else eat before me. And now I feel like the system is so much more accurate that I only have to, like, I usually don't have to pre-bolus at all, if not like just 10 minutes or so. So it's made that a lot easier in my life.
Good, excellent. By the way, in a way, if you think about it, the system is more forgiving because I'm sure it will never happen to you. There are sometimes patients will forget to bolus. I'm sure it will never happen to people on the stage. That's why you were picked, because you're never mind. So the point is that, remember, the system, learns about you every day, but also, let's say you forget to bolus. It will figure out that you need more insulin. So it's going to go like crazy. It's going to take a while before you're back where you should be. But since it can think, it will give you extra insulin to try to make up for you missing the bolus. Doesn't mean I'm not encouraging that. What I'm saying it is more forgiving that way. What do you think? What's happened to your meal times?
I have to admit, I have forgotten to bolus. But I will say that with previous pumps, my blood sugar would have been way higher. So it does do a great job at trying to catch up. Usually I remember, and then okay, probably, try to help it a little bit. But what I've found is when I said I engaged with it, I meant that I'm more proactive about bolusing before I eat. It doesn't give you a free ticket to go to Dairy Queen every day and just say, woohoo, I have a hybrid closed loop system. I can do whatever I want. You still have to be responsible in what you're eating. Eventually we'll get there. But for me, it's key to bolus before I eat. And that's a huge difference also. It's really helped. Whereas before I was lazy, and I said I'd kind of given up because whatever, it still goes high anyways, But this system came along and if you engage with it, it works. So.
Mom?
I just like to clarify one point. If you forget your bolus, it's not going to match a 4 or 5 unit bolus that you should have taken. What it'll do is give you lots of the micro boluses, but there's a limit on how much the pump is going to administer. So your sugar will rise, and then it'll call you out on it and say it's high, and tell you to give a correction bolus. But better than not having the other pumps, which would not respond like that. Before meals, I say the mantra is bolus generously and early to try to match the delivery of the glucose in the bloodstream with the insulin that's on board. If you bolus very short before your meal, you're still going to become hyperglycemic after the meals.
We mentioned that you still have to do the work. One of the problems, one of the issues, realities with the system is that the sensor still asks you to calibrate. So the question is, how often do you calibrate? And what do you do with all these calls for extra calibrations? What do you do with that? Sometimes it's keeps asking you to calibrate all the time. And so, but enough is enough. So how many times do you calibrate?
I calibrate only when it asks me for a calibration. So, which usually ends up being, I should know these stats since I'm on a stage. But is it 8 hours, 10 hours, 12?
Twice a
6 hours for 2, and then 12 hours afterwards is minimum.
Okay, so probably the 12 hours. So I usually only use about 3 or 4 test strips a day when I have to give it a number. But yeah, this system will sometimes get in kind of a calibration loop that can get pretty frustrating. Which Medtronic support, if you're in a place where you can call them at that time, they are pretty helpful in kind of getting you to look at your ISIG values and kind of understand what's going on, which that isn't always going to stop your sensor from ending. Because the sensor is pretty important for it to be accurate since it is making decisions on its own behalf. So these sensors, I think it is important for it to be like something's going on, I need a calibration, you need to check into it, and then it'll say sensor and change sensor if it doesn't think that it has enough accurate data to be making these decisions on these microboluses for you, which as frustrating as it is as a type 1 to have to go change your sensor, it is very important.
So the question is, again, how often do you calibrate, or even how often do you do finger sticks now?
Probably 4 or 5 times a day, depending. My pump also likes to ask me for BG required a lot, as well as calibrations. So that kind of brings the numbers up a little bit of checking. But I feel like it makes sense when it asks you over and over, because that means something is like going on and it's like kind of confused about what's going on, and it needs more information from you. So I feel like sometimes it does get in a loop where it's driving you crazy, but usually if you give it what it wants, it will leave you alone eventually.
It's funny, I have patients who still do 10, 12, 15 finger sticks a day because they don't trust the sensor. And I try to remind them, yeah, but the pump is running based on the sensor information, but just to make sure. So has that changed the number of finger sticks you're doing?
Yeah, it certainly has. I do far less than I used to, because I was, especially with what I do for a living, I was just checking very often because I did not even dare to let it run low. In fact, I would let it run high, just because I couldn't afford to have anything, go low while I was working. But now it's maybe 3 or maybe 4. Just at meals I do, just because, and when it asks me to calibrate. But I'm not like the freaking out like, oh my gosh, I got to know what it is, because I've learned to trust it. Mm-hmm. And for me, that was a hard thing.
Bob, you've been on every pump known to mankind. What do you think about the quality of the sensor data right now? I mean, do you think it's getting better? Do you trust it more now?
I do trust it, and there was a bit of hesitancy about that, because the sensors were getting better and better over the years, and at first it would be off by a long shot, as much as 100%. I mean, so when we were first given the continuous glucose monitor, they said, don't trust the number, trust the trend. Mm-hmm. And that was useful, but it wasn't quite as useful. And I thought, how are they ever going to come out with a pump like this until the sensors become so much better? And now they say, well, the sensors are, thank goodness, the sensors are that much better that they can now come up with a pump that makes these decisions based on your continuous glucose monitor data.
By the way, FDA now bought the argument a couple of times. And FDA, I don't know how much you know about how you assess the sensor accuracy. This measure is usually used as MARD, the mean absolute relative difference compared to the gold standard. And basically, FDA sort of bought the argument, if it's less than 10%, it's good enough to make decisions on. So we are at that stage now. We're approving devices and sensors which don't require necessarily the finger stick confirmation. Let's open it up to a question from the audience. Can we have the house lights on a little bit? Because I have no idea who's here. There should be mics. Yes, Tyler. There's a question back in there.
I'll try the long
No, there's also behind you. Anyway, yes. You go first.
We have a 5-year-old granddaughter that was diagnosed 2 weeks after she turned 2. And when I'm listening to you, I know this is a consideration that they're going to try to get this for her. But when I'm hearing all of you talk, I'm wondering, number one, she can't self-control it yet. She doesn't do her own calibrations and so forth. She can pick her finger, but that's about as far as she goes. And being in school and having other people really be responsible for this, putting in the carbohydrates. The other thing is she tends to be a little grazer when she's eating, rather than sit down and eat everything and whatever. She spaces it out. And I'm just wondering what your feelings are, say if the next year or two she came up for a change. What would your feelings be on that for a little one like this, being in school?
What's the age?
She's now 5. She'll be 6 in August, but she's just in kindergarten.
Yeah, I mean, I think maybe you can answer, Tyler can answer the question.
Yeah, I mean, from an indication standpoint, it's currently approved down to the age of 14. I know there are clinical trials going on to younger ages. So at least from a Medtronic perspective, we can't recommend it for anyone under 14, but we'd have to turn it back to the healthcare providers in order to comment on that.
Yeah, so now you heard a party line, okay? So, and because it's not just there's a gentleman in the back. Tyler, there's a guy with raised hand. No, my point was that that's the party line, but then of course the question is who's gonna pay for it? Because if you prescribe something which is not officially indicated, this is not a cheap entertainment. I mean, I'm sure Medtronic will take your cash, but you know, again, right now it's indicated for 14 and above. Even the sensor has been shown to be, you know, accurate also in children, and now they're extending obviously the ages because clearly they want to sell more of the systems. But your question is important because not just for this, but again, what do you do in this day and age with a child for other people have to deal with? And I don't know what your feelings are because you were a bit older when you were diagnosed, but how do you deal with those kinds of issues in school when somebody else is around?
Yeah, I definitely learned to be responsible for it by myself at a young age. I got diagnosed in 2nd grade, so it was a lot of trips down to the office at school and relying on teachers to help me with it. And a lot of communication with my parents throughout the day. But after, I mean, I feel like 5 might be young to deal with that on your own. But after years of doing it on my own, it taught me to do it, like to be completely independent with it. And I feel like it was really valuable for me in life.
Sure.
But it's a lot of work.
Go on pretty quickly, right?
Yeah.
Yes, question in the back. Yes, sir.
The young lady that's in high school said that it took a lot of effort to get the pump set up with this pump. Could you expand upon that, of what you meant by it took a lot of effort and how long it took before things were more stable with this pump?
Well, at first, it was a matter of trusting it to start with, which was hard for me because I was switching over not just to a different pump, to a different type of sensor that I hadn't used, and I used that kind of sensor years before, but I was on a Dexcom that I learned to trust, and that was difficult. And then it was hard for me to learn to give it what it wanted when it wanted it. And the first couple weeks were really difficult and a lot of work for me and a lot of trusting it, and it was learning me still. It like learns your patterns through the time and how to balance you better. So it takes a while before it really knows you.
Question.
Yeah, I had a couple questions for you. How long is the sensor good for at one site, and does it still kick to a phone, or is that, I heard something about the next generation, you'll be able to alert, like if a family member is a backup, or is the whole sell on here is that you shouldn't have to worry about it anymore, right? Can you tell me, though, do you get 7 days out of the sensor at one location, and can we still have it send a remote alert to a family member?
I think it's 6 days. That it's
No, I think it's 7.
7 days.
it's
7 days.
7. I'm sorry. Yeah.
This one is 7.
And for the most part, I get pretty much 7 days. I have to look and see when it's going to expire so that it's at a convenient time for me to change it. So I might lose a couple hours, but for the most part, on occasion, if it doesn't last the 7 days, I call Medtronic, said, hey, there's a problem. They've always been great about replacing it or trying to troubleshoot, and but that doesn't happen very often.
In a year, it'll be a year in July, I had one sensor that that failed after 5 days. Other than that, seven days every time. You asked about whether it could be sensed remotely, and maybe Medtronic could answer that. I don't know. Do you, like for a parent to know what the kid's doing?
Right.
Tyler, do you want to answer that? What do you have up your
So the
sleeve?
question was, is there the functionality to have this the sensor reading shared across the cell phone or to a remote location? Currently on this model, the answer is no. So anyway, future iterations are where we'll look for that. So that's right, yeah.
There's a question there, Tyler.
I think he has more questions.
Can I ask one last?
Yeah,
are these
briefly, yes.
Are you going to have the algorithms set to deal with the new fast-acting insulin coming out? Like, are you going to be able to use that?
You're talking about FACP? So, do you want to answer that?
I probably can't do it very well.
Well, can't do
It's
that.
going to be future iterations, but
Yeah, but what we're doing, since I can answer that, we are trying to actually use FACP, the faster-acting novel log, in patients with pump, just like individual injections, because we need to learn. Right? Because remember, the promise of that is that hopefully it kicks in faster and then hopefully leaves your body a little bit faster. So for a lot of patients who don't want to wait 20 minutes or so before they start eating after bolusing, it potentially could help. If you look at the studies, it looks like you get maybe 50% more insulin kick in the first 30 minutes. Okay, but again, we'll see how it's going to play out because no studies have been done with 6-7 days with that insulin, but we're using it and we're getting some information from patients now. Yes.
Right here.
Oh, okay.
Our daughter is currently on the Dexcom G5 without a pump, and I know that one of the big things with that was the accuracy there is such that she's allowed to dose for meals from the sensor data. Did you say that the Medtronic is at that point right now, or do you need a finger stick when you before?
So fascinating. The question is, can you dose off the Medtronic sensor? And it's sort of interesting because this is, I guess, politics of the Medtronic or FDA, who knows? Because officially, only Dexcom G5, Dexcom G6, and the Freestyle Libre from Abbott are officially sanctioned to be non-injunctive, meaning that you can change the treatment based on readings, okay? Medtronic is not really approved for that. And it's really interesting because yet FDA allowed this to be marketed when the pump gets activated by the results from the sensor data. Say, okay, so what's the problem, right? It makes no sense, but in a way, and again, I don't work for Medtronic, if that was intentional or what, if they don't just care because it's approved, but the sensor is officially not approved, you have to do calibration, you have to confirm with a finger stick, yet they trust the pump to do its thing, even through the night, based on the data from the sensor. So go figure. What do you guys do? What do you do at meal times?
I trust my sensor typically, but I do test.
I usually test at meal times just to be safe, but I would trust the sensor.
You?
I've done both. A lot of times I've forgotten to test because I'll look at my sensor, but oh, okay, I'm cool. It's, it's
you
like.
Trust the sensor?
I trust it. Unless it's like something really off, but that's like never happens. Yeah. So.
And I do not routinely test before meals.
Okay.
Before breakfast, always, upon awakening, but not, I would say often not, usually not for lunch.
Yes.
I'm wondering, when you talk about the extra work that it takes, are you referring to being sure that you pre-bolus a certain number of minutes before you eat? If so, how long is that time that you have? What's that window that you're looking at? And is it, that window that I'm talking about being extra work and also being more accurate with the carb counts? I heard you say that. And then finally, please don't ever refer to yourself as being lazy, because diabetes is so demanding, and you're doing the job of an organ. So please never say that.
I can talk to that.
Yeah, why don't you answer the question about
I really think that the work being put into it depends on the person. I have never really been a person that my endocrinologist has told me to pre-bolus, so I really don't do that, whereas it works better for her and other people. So I think that's going to obviously sway some people's effort put into that factor of the pump. And I think a lot of, it's person to person. This pump, in my opinion, I work less now that I've kind of gotten over my carb counting mishaps that have been going on for a while. Just the peace of mind that this pump gives me, even just like earlier when I was trying to think of how often it asks me to calibrate or how many times I check, I think that speaks to how much I don't think about my pump now. Even when I go see my endo, he'll ask me questions and I'm like, I don't know. And he's like, that honestly like makes me happy that like diabetes isn't consuming your every second. But when you do get this pump started, you do have to be in manual mode for a week and it's learning you, and it is really hard to kind of let go. I'm sure everyone here has seen their sugar completely plummeting, chugged a juice box, and then auto mode took care of it, and then I was high because I didn't trust that it was going to cut off my sugar, and I was like, pound a juice box, and then I'm like 250. I think a lot of the difficulty with this pump for me is like the emotional and like everything that comes with diabetes about the worrying and not wanting to let go and let this machine like think on its own. And it's hard to get out of those habits that I've been living with for 12 years.
So unfortunately, we're running out of time. I want to make sure Dr. Hood gets his time. Dr. Alcas had a comment.
I just want to make
Yes.
one point. Your ability to manage your diabetes is reflected by your ability to carb count, whether you're on the pump or on injections. If you can carb count, you're way ahead of the game. I personally find the pump is not extra work. I find it liberating because it takes out so much of the moment-to-moment fuss that you normally have to deal with, that this just takes care of for you. You just put it in your pocket and you go for the bike ride, or you go to work and you don't worry about it, or you go to bed and then wake up, it's 110, 115.
This is the most, sorry to interrupt, this is the most normal life I've had in
Since diagnosis.
Since 1995. So I don't have to be the pancreas anymore, and I didn't do a good job at being the pancreas. That's what I had to do. That's what you have to do. You between you and the pump, you had to be the pancreas. And that's when I said I got like lazy and like, oh, forget it. This is as good as it gets. Well, no, it's not. This is not as good as it gets either. It's going to get better.
It's going to get better, yeah. So with that uplifting comment, we have to finish. I'm so sorry, out of time.